mental health in later life. Orientation and course introduction, part 3. In this lesson, you will learn about what is mental health, how do we measure mental health, and what are the determinants of mental health. So what is mental health? And this is the first concept we need to understand for this module. At this point, may I request that you pause this video to complete the following survey. You may either key in the web link above or use the QR code below to access the survey. Now, there are 3 short questions in the survey. On the survey, after submitting your response, you need to click the next button at the right lower corner to proceed to the next question. Now, I will share the results of this survey on the discussion board after all the students have completed the survey. So what is mental health? The surveys have shown that there are many definitions and interpretations of mental health, but most people equate with being happy, having a healthy mind, or a healthy body. Some see it as the ability to cope with daily life. What is significant is that a large proportion actually perceive mental health as mental disorders such as dementia, depression. And this definition of mental health actually also varies very widely with different social cultural background, different countries, with some people believing that mental health means being freedom from the evil spirits. And that is not necessarily wrong. The trend that mental health is frequently being perceived negatively is also evident in the academic domain. Research studying the negative aspect of mental health far outstrip the positive aspect in a ratio of 17:1. In order for us to understand and develop effective intervention, it is important that we have a common definition. Therefore, in year 2002, WHO had defined mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to his community. So with that, there is now a shift towards a more balanced view of mental health. For example, in 1997, Job defined mental health literacy simply as the knowledge and beliefs about mental disorders, which aid in their recognition, management, or prevention. Now, with new definition, we recognize that this is not just about mental disorders. So in 2014, Kuchar provided a more holistic definition of mental health literacy, which is understanding how to obtain and maintain positive mental health, understanding mental disorders and their treatment, decreasing the stigma related to mental disorders, and enhancing health-seeking efficacy. So now we need to recognize that mental health is a full spectrum, okay, with both positive aspect and negative aspect in the form of a mental health disorders. For the positive aspect, it can be seen as life satisfaction, subjective feeling of well-being, and quality of life. And this can come in the form of, for example, having good social relationships, having social roles that we play, having good health and functional ability, living in a good house and neighborhood, having a positive outlook, having adequate income, maintaining independence and control, and having a religion or maintaining one's spirituality. So for us to understand the trends and develop effective services in mental health, we must know how to measure mental health. So The commonest way of measuring mental health are the ones related to mental disorders, meaning we measure people with mental disorders, such as we use the patient health questionnaire, the geriatric depression scale, to measure the presence of depression in our studies. We can use the general anxiety disorder questionnaire to measure anxiety disorders. And very frequently, which most of you would have heard of, which is the mini mental states examination, which is MMSE, is been used to detect dementia. So all these measures of mental disorders can be used as measures of mental health. However, while these tools are relatively easy to use, negative mental states can exist in the level which is not severe enough to meet the diagnostic criteria of mental disorders. But these non-disease negative affects are equally important because they also impact on our mental health status and outcome. So there are also measures which allow us to measure just a degree of psychological distress. The negative effects such as nervousness, hopelessness, restlessness. Nothing could cheer you up, and feeling of worthlessness. So skills such as the Kessler Psychological Distress Scale, which is shown in the slide, measures the degree of psychological distress without needing to conform to a specific mental disorders. Okay. Now, we also know from the earlier part of the lecture that mental health is not just about disorders and distress. We can also decide that we want to measure well-being, the positive effect. We can measure mental health in terms of the positive emotional states by using scales such as the WHO Well-being Index, which looks at feeling of cheerfulness, being in good spirits, being calm, relaxed, feeling vigorous and active. Another way of measuring well-being is to look at it from a little bit more cognitive perspective, measuring one's life satisfaction with the circumstances that they are in. Now, we can also choose to measure a more balanced way, both the positive and negative aspects of mental health. For example, the General Health Questionnaire is a fairly short, reliable, sensitive form of only 12 questions that can be self-administered. And this is frequently used to screen for minor psychiatric disorders in the community. So to sum up, there are many, we can measure mental health in various levels, from the positive effect, positive well-being in the form of life satisfaction, negative aspect in the form of degree of psychological distress, negative aspect in the form of mental disorders. But this is not important for you to know every single of these tests. There are too many. But it's important for you to be aware of what you want to measure and then looking for the appropriate tool to measure that. Now we will now discuss what determines our mental health status. So does mental health decline with age? You would have answered this question in the survey, and we will now look at it. DNS reports on the results of the second World Values Survey is one of the landmark studies in this area. It studied approximately 60,000 adults in 43 nations. And in this study, it showed that life satisfaction remains fairly stable. In fact, if you look at the line, there's a very slight increase, which is statistically significant in life satisfaction with age. And this occurs despite decreasing resources, such as you can see on the graph, income, marriage, and the degree of control in one's life, as well as physical health. Now, however, looking at the positive and negative aspects of mental well-being, you can see that the positive effect does decrease with age, whereas the negative aspect but affect emotions remains fairly stable. So this relationship between age, physical, mental health, as well as self-reported health has been studied again by Loren, whose team studied a very large sample of 40,000 adults divided into 3 cohorts over a period of 34 years. Now the results of the 3 cohorts are displayed next to each other. In all 3 cohorts, as you can see, the self-reported health declined with age. And this coincides with a progressive rise in the comorbidity with age. Yet, the mental health symptom, which is the lowest tables, it shows that this has been largely stable. And in fact, there's also a slight uptick, slight increase from 60 years of age. Now, when the effects of physical disease is being corrected, age, in fact, in this study is associated with a slight improvement of mental well-being. But since we know that physical diseases is associated with poor mental health, and since many of adults accumulate chronic diseases with age, doesn't mean that most of them have poor health, poor mental health. Now let's look at it. So the European study of adults' well-being reported that less than 10% of older adults actually rated their health as poor. And if you look at the table, from 50 to 80 years old, the proportion of elder adults reporting their health as poor, signified by the black rectangles, remains fairly stable despite increasing age. And if we compare those with a low degree of chronic diseases and those with above average level of chronic diseases, even those with above average chronic diseases, those who have many physical illness, about 80% of them still report having fair to excellent health status. So, which means that not all physical diseases may not always be associated with poor mental health. So, to sum up what we have discussed so far about the determinants of mental health, first, older adults, most of them have good mental health in general. The increasing age is not always associated with poor mental well-being. Chronic diseases and physical ill health is also not always associated with poor mental health. So why is that so? Looking at this picture, then you will realize that the relationship between age and mental health is a lot more complex than just physical health status. Now, if you look at it, age is associated positively with mental health. Socioeconomic status is associated positively with mental health. But the fears of the safety of our neighborhood is associated negatively with mental health, while physical activities is associated positively with mental health. To illustrate again the need to take a broader view of mental health in late life and its determinants, we look at this study by Swift. And Swift showed that the improvement in subjective well-being with increasing age is only observed in countries with higher GDP. And you can see that in contrast, older adults living in countries with lower GDP experience declining well-being with aging. So looking at all the determinants of mental health, we can classify them in a fairly commonly used and simple model called the biopsychosocial model. Biological factors include genetics, age, gender, and organic illnesses. Some of these are not really modifiable, for example, age, genetics, and gender. Psychosocial factors are more modifiable to a certain extent. Psychological factors include self-esteem, mastery, optimism, sense of coherence, and spirituality. All these have protective effect on our mental health. Social aspects include discrimination, our ethnicity and our cultural background, a degree of financial security, education level, the social roles we play, as well as our housing and environment. Religion clearly plays an important role in our mental health, with both psychological and social facets attached. So the reason why older adults continue to enjoy good mental well-being despite declining resources is really not very clear. In fact, it has also been shown that resilience, which is our ability to bounce back from a state of adverse events, does not decrease with age. So despite having less resources, this elderly still retains their ability to stand up to adversity, to bounce back or return to its state of equilibrium following adverse episodes such as new diseases, catastrophic diseases, or change in their social circumstances. So resilience is associated with better health and well-being, higher social interaction, and increased level of spirituality. So some explanation for this paradox of well-being have been explored, and how this protective effect of age may be related to adults making an accommodative shift that aligns their aims and goals with what is achievable, meaning that they adjust their expectation based on the assessment of the situation to still achieve a certain degree of life satisfaction. They may also have improved ability to regulate their own emotions. They also have a more mature set of coping strategies and defense mechanisms that will enable them to deal with more effectively with any emotional challenges. And lastly, with life experiences, this elderly may also become a bit more selective in terms of their choice of social partners, choosing friends and family who are able to provide them with positive emotional feedback and support. So as we've talked about, resilience is associated with better health, bigger social connectedness, and therefore successful aging has frequently been stereotyped as one who is physically capable, has good cognitive function, is well connected with a large social group, and always displaying positive emotions. Now, however, it need not always conform to this stereotype. You know, what about them? You are they aging successfully? Or does being the opposite of the phenotype that you saw earlier means that they have poor mental health? So geotranscendence describes that when a person ages, there's actually a perspective shift from a more materialistic and rational view of life to a more transcendental one, leading to significant change in the way one perceives self, in the way one perceives his relationship with other people and life as a whole. So this in turn is associated with a decreased obsessions with one body, a decreased interest in material things, increased need for solitude and understanding of oneself, decreased desire for the superficial social interactions, and being more selective in activities and social interactions. And this may partly be accounted for by elderly rationing their stamina and their energy to things which are more important to them. So refuse not being as active as what we saw earlier, not liking to go out and socialize and take part in these social activities, need not mean that the person is being depressed or being so-called lazy or introvert. It may just be a shift of their priorities and their perspectives. So next time when we see an elderly, now we must remember that most of them remain in good physical and mental health. And it may be more useful for us as senior care providers to see them as evolving adults with changing priorities, changing aims, and changing strategies rather than one that is declining. Therefore, to sum up what we have learned in this week's lesson, number one, most older adults remain in good mental health despite increasing age and chronic illnesses. And when we evaluate mental health, we must adopt a balanced approach looking at both its positive and negative aspects. Determinants of mental health can be classified into the biological, social, and psychological domains. Some of these may be modifiable, some may not be modifiable. Psychological resources can be very valuable in helping us to maintain our mental well-being under the conditions of poor health in later life. So this is the end of this week's lesson. If you have any question, you may post them on the discussion board or you may email me directly. I will also encourage you to read the additional reading materials that have been uploaded for you on Blackboard Learn, and also check out the discussion board later this week for the outcomes of the survey that you have done. Thank you.